Welcome to Behind the Scroll. Could you please introduce yourself to the viewers?
Thank you for having me here today. My name is Onifade Aliyah and I'm a 300 level nursing student of College of Nursing Science, National Orthopedic Hospital, Igobu, Lagos. I'm very passionate about tech. I'm very interested about tech. So I'm currently learning product design. Even though juggling nursing school and tech classes have not been easy, but it is doable. Also, I'm a Muslim, a practicing Muslim, and also the second daughter of my mom.
Thank you for that brief introduction, Miss Alia. Could you please tell us what influenced your decision in choosing nursing as a career?
Okay. Coming to nursing school in general was not even part of the plan because I initially wanted to be a cardiac surgeon. I got my inspiration from K dramas. Like I love watching K dramas back then in secondary school. So I initially wanted to be a cardiac surgeon, but jam me. So I my first jump I scored to 30. So and I was not able to get admission into any university to study medicine. And this school flyer just popped up. Like my auntie sent it to me, and she was like, "Okay, why don't you apply for nursing?" And I was like, "Okay, nursing, medicine, okay, it's doable. Like let me just apply." It's also part of the medical, it's part of the healthcare professionals. So when I applied for nursing, honestly, I was not even expecting anything from this school because they took time in expanding, they took time in the admission process and everything. So I was not expecting anything from them. And when I saw my admission later, I was like, okay, let's just do it. It should be doable. So when I chose nursing, some of my uncles and aunties they told me that, okay, why do you want to be a nurse? Nurses are just there to assist the doctor. And I feel like that's the misconception that needs to be addressed because when I came into nursing school and going for clinicals, I found out that nurses are not just there to assist doctors. We as nurses, we play vital roles in the hospital, especially for our patients, and we are also change agents in the healthcare profession. And I feel like that's something that needs to be appreciated because our efforts are not they are not small in making our patients to be healthy and for them to be able to go home very healthy and very well. Thank you.
People say self-care a lot. What are some simple things we can do to without stress to improve our health?
Okay. Self care doesn't have to be complicated. It's just about the simple, daily, consistent habits you do every day. So, something as simple as sleeping very well, eating regularly, eating balanced diet, emphasis on balanced diet, eating balanced diet, taking enough water, and going out for a walk or doing exercise can help to improve our health in a very massive way if we do them consistently. So, daily healthy lifestyle habits are something that they don't have to be very big. You don't have to start from like a very big. You don't have to start very big. You just have to be consistent with the daily little habit that you do every day.
Okay, thank you so much. What do you like about your profession?
Okay. What I like about nursing, I've actually not really thought about it that much, but I just see nursing as a profession that combines compassion and that combines compassion and providing quality health service to patients. So nothing in this profession that is going to make you to be very vulnerable, like very like vulnerable to your patient. You're going to be able to empathize with your patient, and you're going to be able to like feel what you will be selfless when you're in nursing because you cannot just see people crying over their loved ones. Like let's say for example, so a patient died and you see the loved ones crying and you just be aggressive and be like, okay, like you just start like being aggressive. No, nothing in that profession that is going to make you to be able to empathize with others and be able to support your patients and their family through every stages of their care and be able to provide proper health education to other people because prevention is better than cure. So you be in nothing, you'll be able to health educate the people on healthy daily lifestyle habits that can improve their health and also help them very healthy when they practice it.
Okay, thank you so much. So, Miss Halia, for someone juggling school or work, what are small, easy habits we can start with to stay LD?
So for someone juggling school or work, the small daily health lifestyle habit that you can start with, you can start by taking enough water regularly. Then ensure you take water. It's not until when you are thirsty that you take water. You eat balanced diet. You ensure you eat balanced diet. Don't joke with your sleep. Rest when is needed in order to avoid burnout. And you also ensure that you take like little walks. You can just go for a walk. You can go for a walk. You can exercise. You can do exercise in order to be fit. And these small, consistent habits are what help us to be able to balance our busy life with our health. So these habits they may look very simple, but they go a long way in giving us a very healthy body. Also, you can do your best when you are at your best. So don't overwork yourself. Don't try to push yourself into doing something when you know you are tired. When you feel overwhelmed, you talk to somebody that you know that you are very close with, and you just go for little walks and take enough rest that you need. The work is not running, nothing is going. You are still going to come back to meet them. So whenever you feel overwhelmed, whenever you feel tired, or you feel like everything is just too overwhelming for you, just take breaks, have a very good sleep, eat healthy, and drink enough water. Thank you.
Okay. So, if you would change one thing about nursing, what would it be?
Okay, that's a very funny question. So, if I would change one thing about nursing, especially in Nigeria, it would be the welfare of nurses, that is their salary and the working conditions. Nursing profession in general is a very demanding profession. It's demanding physically, emotionally, and mentally. Even just passing through nursing school is demanding, not to talk of the profession. So changing their welfare, that is their salary and living working conditions, is something that needs to be done because nurses need to be nurses need to feel more supported and appreciated for the very good thing they do in the hospital, in the healthcare profession. So they need to feel more appreciated and supported because they play a very vital role in ensuring that are safe and patients receive holistic care. So nurses need to be more appreciated and they need to be more supported for what they do. Thank you. Okay, thank you very much to Behind the Scrub for hosting me in this podcast. I really appreciate it. And they also gave me a gift. So thank you very much, Behind the Scrub.
You're welcome. Thank you for honoring our
You're
invitation.
welcome. So,
See you.
bye.
Bye.